evening. Today I'll be talking about air pollution, lung cancer risk, and what we can do as individuals to reduce or minimize our risk. My name is Dr. Praful. I am a medical oncologist, and my areas of expertise or areas of interest are in preventive oncology, predominantly air pollution, plastics, microplastics, genetic screening, genomic screening, and other aspects, so that people can avoid such diseases rather than having to face the burden of treatment. Very quickly, what are the air pollutants and which ones matter to us? There are particulate matter and there is gaseous pollutants. What is most important for us, as we have heard in the news, is PM 2.5, as you can see here. PM is particulate matter, 2.5 micron is the aerodynamic diameter of the particle. Why this is important is, depending upon the size of the particle, it will be decided where it gets deposited within the airway. So PM 2.5 typically go into your smaller parts of the breathing tubes, basically the bronchi, bronchioles, and reaching up till the alveoli. In modern times, we have gone up till ultrafine particles. These particles can actually cross the lung membrane and even reach the blood, as have been shown in many recent studies where microplastics and ultrafine particles were found in plaques in the coronaries of patients as well. As compared to this, we also have gaseous pollutants, sulfur dioxide, nitrous oxide, carbon monoxide. So sources overlap, but the main difference between them is what they cause. PM 2.5 is the most notorious for causing lung cancer, worsening of underlying disease, basically people who are on inhalers, so they may require more frequent admissions, heart disease, hypertension, stroke, and inflammation within the body. This is important. Why this happens is because PM 2.5 by itself does not do much. Basically, it is a carrier. The smaller the particular size, the more the surface area per mass of that particle will be there. And once you have pollution, there are a multitude of carcinogens, as will be discussed subsequently, which can adhere to the surface of the PM 2.5, and PM 2.5 allows or carries them to the areas where carcinogenesis can take place. Apart from that, these pollutants which are being carried by PM 2.5 can also cause inflammation within the lungs, and inflammation has been known to be a driver for increased blood pressure, strokes, heart disease, which is why there is very strong evidence that PM 2.5 actually causes these diseases, as will be subsequently covered. Gaseous pollutants, on the other hand, while some are associated with lung cancer, most common symptoms most of us would have experienced would be irritation in the eyes, irritation in the throat. People who are asthmatic or who are chronic smokers and have COPD, during the smog phases, they may have a higher inhaler requirement or a need for nebulizers, or perhaps more frequent need for admissions. But as compared to PM 2.5, there is a risk for cancer. There are carcinogenic gases also, but PM 2.5 remains the main driver. So when we talk about how much is air pollution impacting us, what we can see here is, this is Indian data for year 2022, when it was last published in this regard. This is annual mean level, because PM 2.5 is a cumulative exposure. Annual mean level tells what an average citizen faced, the level average citizen faced of PM 2.5 throughout the entire year. This figure is important because depending upon rain, time of season, crop burning, Diwali, high pollution, or traffic load, the PM 2.5 can fluctuate on a daily or a weekly basis, but the risk of cancer is predominantly defined by the ongoing exposure that is happening. So 70 deaths per 1 lakh people are attributable to air pollution directly, most commonly COPD and infections, and then we also have lung cancer, which is responsible for 1/5 of the deaths of air pollution related deaths. So what are the carcinogens in air pollution? So just a simple understanding of what IARC is, whenever we make a claim or we see an article that, for example, red meat causes colon cancer, or, coffee protects against ovarian cancer, there is a flood of such articles or things. So What IARC does is it classifies on a basis of an objective system whether a particular substance is causing cancer in humans or not. And group 1, which is sufficient evidence in humans, basically means two things. That one, we have documented that as the exposure increases, the risk of cancer increases, a particular cancer increases. And two, we have worked out in preclinical models, maybe rodents or organoid cultures, how this particular pollutant is causing cancer. So this is so what because we cannot have interventional studies here. We cannot ask half people to be exposed to a potential carcinogen and half of them to not be exposed and then see the difference. So this is the best possible evidence that we can have. So in regards to air pollution, we have at least 10 documented IARC group 1 carcinogens in air pollution that are leading to lung cancer. Very important amongst these are PM 2.5, diesel exhaust engine, and for suburban and rural areas, household combustion of coal or use of biomass for cooking. So just a small slide on what the evidence says and how do we know whether air pollution is causing cancer or not. So a multitude of studies have already been done. The word mentioned here is meta-analysis. When we have a lot of studies on a particular area, then we can club the results if the findings or the included population was similar. So on an average, 14 to 21 studies were included in all of these studies. And you can see that for every 10 microgram per meter cube increase in PM 2.5, there is a relative risk increase of 1.3, which means 25 to 30% higher risk with each 10 increment in PM 2.5. The bottom figure is extremely important, as I will discuss subsequently. This being in a polluted area is not justification for smoking. The risk is multiplicative in smokers if they are staying in areas with high air pollution because the mechanisms are synergistic. So if we talk about lung cancer today in India, in historic times, smoking used to be the predominant risk factor, accounting for more than 80 to 90% of lung cancer cases. That figure has now fallen down to 62% and continues to fall as tobacco cessation is happening. 1 in 4 to 1 in 5 lung cancers are caused attributable to air pollution with some impact of second-hand smoking, indoor solid fuel exposure and radon exposure, which is predominantly more irrelevant in southern states. Delhi, unfortunately, is uniquely vulnerable. Why? Because it is landlocked by the Himalayas, leading to lower level of the ground, so that the denser or the more heavier particulate matter has higher propensity to deposit here. Secondly, we have a very high emission density because of vehicles, industries. We are also downstream from the crop burning that is happening. And lastly, the population of NCR by itself and the crowded living ensures that a lot of people are forced to face this particular risk of pollution. So as I mentioned, pollution versus smoking. So briefly to tell why these are additive and why one is not justification for the other, although this may become slightly more into the realm of medicine. What happens is there are pre-existing clones within our airways that have propensity to cause cancer, but they have not acquired characteristics to become cancer yet. Cancer has hallmarks. Essentially, cancer is any group of cells that fail to remember their designated job and multiply without reason. That is a malignancy. And then subsequently it can spread to different parts of the body. So it is not a one-step process. There might be cells in your airways that are probably more prone because of certain mutations. What air pollution does is, because of the chronic inflammation and DNA damage, it promotes those cells to grow at a faster rate. As opposed to smoking, which increases the number of cells which may have the propensity to cause cancer. So if one is the seed, the other is like a fertilizer, which is why if you have a combination of both, the risk is multiplicative and not additive. Additionally, indoors are, unlike popular belief, in many cases perhaps worse than outdoor air quality. We all know the obvious sources such as agarbatti, dhupbatti, scented candles, use of mosquito coils and vacuum cleaners which are not using HEPA. But apart from that, things like cooking and cleaning products which are aerosolizing, or violent dusting of the furniture, can also lead to a worsen air quality indoors as compared to outdoors. So what is the magnitude of problem right now? This is our air quality data today in Delhi. So our AQI today is 72, classified as moderate. PM 2.5 is 21, PM 10 is 31. So why I have put this figure here? One thing that we have to see, which will be covered in the next slide, is what is AQI? Because we hear it very commonly. If everything is being caused by PM 2.5, then why are we hearing AQI in every news article and every aspect? And why are we making decisions such as masking, air purifiers, or even closing schools, encouraging work from home based on AQI? Second thing that I want to drive home from this slide is that while the PM 2.5 today is not that bad, if you look at the historical air quality data, there is significant seasonal variation, with the PM 2.5 going as high as 179 on certain areas. As I mentioned previously, it is the cumulative exposure that is important. So what is a good PM 2.5? Unfortunately, there is no safe lower threshold. In countries that have a PM 2.5 of 5 to 10 average mean, there they have seen that cumulative exposure starting from even 2 to 3 going up till 20 has an incremental risk of cancer. However, reaching that PM 2.5 concentration on a national level is not practical. So the current WHO guideline recommends 5, which has been updated from a previous guideline of 10. Global mean remains 46, with vast majority of Southeast Asia having levels more than 100, which means that perhaps two-thirds or more of the global population is living in a PM 2.5 concentration far above what is recommended by WHO. So if PM 2.5 is the main determinant, why do we even, what is AQI and why do we need it? So this is a complex slide, but to simplify it, basically we have multiple pollutants, as I mentioned. We have PM 2.5, PM 10, nitrous oxide, sulfuric oxide, ammonia, and whatnot. Now, and they have different units of measurement. They also have different time frames of assessment. PM 2.5 is relevant on a cumulative basis, but when you look at gases, then the peak concentration is more important, perhaps even hourly in certain countries. Not to mention that when we are talking about the monitoring infrastructure that is available, perhaps some monitors have PM 2.5, some monitors only have PM 10, since PM 2.5 monitors have been integrated more recently as compared to PM 10, but we need to give out information how bad is the air today. And there is differential influence of weather on these. So the problem is that we have to take all these variables that are there, different unit, different pollutant, different time frames, and we have to give one simple advisory. Should the schools be closed or not? Should you mask today or not? Should you use an air purifier or not? So that is where AQI comes into place. I won't go into the calculation much, but what it basically does is it takes the 7 to 8 key pollutants depending upon the relevance of that particular nation. There is an equation which is put, and a value is given from 0 to 500, and that can be disseminated on a daily basis. So in India, PM 2.5 includes, so AQI includes PM 2.5, PM 10, SO2, nitrous oxide. Ammonia is important because it is specific to India, because we have higher biomass fuel usage, which lead to ammonia, the carbon monoxide and ozone. So you will see here we have 8-hour max, while in many Western countries it is a hourly maximum. Because we do not need to give hourly readings here, we need to give a daily basis reading, because that is the requirement for us, school closing or whatever. So what it does is, we measure these pollutants by the whichever sensor is there. Not all sensors will measure everything. So ideally what we need at least 3 pollutants, out of which only one needs to be particulate. And then for each of them a subindex is calculated, and the highest subindex is your AQI. That is it. So it just answers a simple question: how bad is the air today? does not tell whether it is a risk of cancer or whether it is a risk of respiratory disease or eye irritation, that what is the worst possible scenario that can happen with this air today. It is mainly meant for short term action only. AQI does not define the long term risk of cancer, that is PM 2.5. Unfortunately, just the PM 2.5 measurement itself is also not enough. As I mentioned, PM 2.5 is a vehicle. So its capacity to cause cancer depends upon what is on its surface. When we have forest fires or crop burning, the type of organic compounds on the surface are more carcinogenic, for which we have for the same PM 2.5 concentration, these PM 2.5 particles are on an average 5 to 7 times more carcinogenic, even in people who are not living in the exact area or are living downstream. So, regarding the downstream data, that is not from India, that is predominantly from California forest fires, but the nature change in PM 2.5 and higher carcinogenicity has been confirmed in Indian settings as well. So, now that we are living here, how do we prevent it? They are basically classified as public and personal. WHO and many other international bodies typically do not aggressively endorse personal measures because the viewpoint there is that you are shifting the onus of protection from air pollution on the individual, while it should be a systematic thing that should be done by the perhaps the governing body or whatever. But on a personal level, air purifiers, masking, and some behavioral modification is important. And while there is perhaps no way to show that using these reduces the risk of lung cancer because there are so many other variables, we do have evidence that these lead to one, reduction in inhaled PM 2.5, and two, the impact of inhaled PM 2.5 that you can measure immediately. So, reduction in blood pressure, reduction in inflammatory markers. Now, these have been documented with some appropriate masks and some appropriate air purifiers. So, it is intuitive that it will lead to a lesser risk. However, perhaps the level of evidence will never go beyond this, because how can you take 1,000 people or 10,000 people and then quantify their PM 2.5 so exactly over 10 or 20 years so that you can find out the difference? So this is perhaps the best possible evidence that we can have. So moving on to the key aspect of the talk, air purifiers and masks. How do we select one and how do we use them? So when we talk about air purifiers, they basically typically, most air purifiers in the market have 3 layers. They market themselves as 3-layered defense. So there is a pre-filter, there is a HEPA filter, and there is a carbon filter. Without going into extreme details, pre-filter is a sacrificial layer. It is weeding out all the coarse visible debris, for example, hair, pollen, dust. This is there because the main heavy lifting for PM 2.5 is done by HEPA. So if the pre-filter layer is not there, then these particles will also be captured by HEPA and the lifespan of HEPA will reduce. While pre-filters are simple meshes which can be cleaned, HEPA filters cannot be cleaned in the home. They have to be replaced because the meshwork is there within them, which works via stopping the diffusion of the particles and by electrostatic charges as well. Washing disrupts those fibers and significantly impairs the efficacy. The third and often misunderstood layer is the carbon filter. So the activated carbon is meant to absorb the gaseous pollutants that are there. Realistically, to reduce perhaps your room's sulfur oxide levels or nitrous oxide levels to undetectable ranges, you need kilograms of activated carbon, which is not feasible at all in an air purifier. It is mostly there in industrial grade purifiers. What air purifiers have are polypropylene sheets with activated carbon on the surface. So the maximum difference you will notice with this layer is perhaps odors or cooking smell that is there in your room can go away. This is also the first layer to run out. This is important. So important here because just because cooking smell has come back while using an air purifier after certain time of use does not mean the purifier is not working. How to assess whether the purifier is working or not, I will be telling. So, when we talk about purifiers, it is important to know what is HEPA and what are the alternatives. There are ionizers which are there. There are photocatalytic oxidation methods that are there. Ionizers give an ionic charge to the pollutants, make them clump together so that they get stuck. Photocatalytic oxidation tries to oxidize them directly. They are typically not as efficacious as HEPA, and ionizers unfortunately can also cause ozone generation, which can be bad on the airways and the eyes, which is why most evidence that we have for reduction in PM 2.5 and everything that I have mentioned is based on HEPA. So how do we know if we are even buying a HEPA? So HEPA is high efficiency particulate air. It is a standard. HEPA standards go up till 19. Anyone who has ever bought an air purifier from Amazon must have perhaps seen the word H13 or H14 there. So they have objective definitions based on 0.3 micron particles. For a household, H13 is enough. So you can buy H14, it is only slightly more expensive, but because the pores are much smaller, the fan speed needs to be much higher, and they may perhaps cause more noise. For all practical purposes, H13 is okay for a household or an office, and most of the research that has been done regarding indoor air pollution with air purifiers has been done on H13 standard purifiers only. It is important when buying to note terms like HEPA-like, HEPA-based, HEPA-type. These are not HEPA. If a brand has HEPA, they will mention H13. Also, many brands instead just mention, that perhaps 99.97% particles are captured, so as to perhaps indirectly try to indicate that, this is also HEPA. But most of them will not mention the particle size. It's not just the percentage. It is 0.3 microns of particles. So, simple takeaway from this slide, when choosing an air purifier, just hunt for this term, H13. If the purifier has it, they will mention it. Second thing, when choosing an air purifier is, which purifier do I take for this particular room? So what is important, I won't go into the equation too much, but typically a lot of brands, what they will do, they will mention that this air purifier is adequate for this square footage of area. Okay, what actually the good brands report is CADR, clean air delivery rate. Basically, meter cube of clean air that is being delivered per hour. For a clean room or a clean area, you need 4 to 6 air exchanges per hour. Okay, so what they do, for example, if they want to oversell the efficacy of the air purifier, they will not mention CADR. They will just mention what the effective room area is and make an assumption of air exchanges of 2 to 3. So perhaps a cheaper air purifier seems adequate for a larger room, prompting the consumer to buy them. In all practicality, you should always hunt for the CADR, and you don't have to go for complex calculations. Just write on ChatGPT whether this CADR at an air exchange rate of 6 is adequate for this square footage of room or office or not. Another thing, when we are talking about this CADR, the reported CADR is at peak performance. That is the fan running at highest speed, which will lead, perhaps in a lot of brands, lead to a significant amount of noise, which may not be appropriate when you are sleeping or when you are in an office space. So, also, many times when air purifier is being used in the bedroom at night so as to avoid the sound, so that for sound sleep, people switch on the sleep mode. Now, sleep mode is essentially nothing but reducing the fan speed. So, the CADR reduces. So if in case you feel that, that for this CADR is just adequate, so you can always, good brands will always tell you the decibel sound on different modes. Otherwise, if there is a piece that is there in the shop, you can just ask them to run it. If at peak performance or turbo mode, the noise is unacceptable for you, it is better to buy an air purifier of a higher CADR or of more square footage so that you have relevant clearing of the air in that particular area. So these two are the most important things, the cadre or the size of the room and whether HEPA truly is there or not. Then pre-filter, as I mentioned, is a layer before the HEPA. It can be cleaned via vacuuming, and its main job is to protect HEPA so as to prolong its life. So how does this factor in when choosing in an air purifier? First, see if there is a pre-filter. If there is a pre-filter, they will typically mention, and that mesh or foam will directly be visible. And always ask, how do I clean this pre-filter? It should be easy to remove, easy to clean. If you require screwing out nuts and bolts and then 20 to 25 minutes to clean, you will probably not do it, and then the air purifier will stop working faster than usual. Also, once you are using the air purifier, whenever you're cleaning, you can just see whether there is uniform loading of dust or not. That is also an indicator of a good pre-filter. Carbon, as I mentioned, is mainly for gases. The amount in air purifiers will not have a meaningful impact on the inhaled amount of the gases that are there. What it will do is perhaps reduce the smell, reduce the cooking smell. This is important because while it is not relevant for most households or offices, this is the first to run out. Okay, and many brands sell pre-filter, filter, and the carbon together as a modular filter. So, as I will be telling in the subsequent slide as well, you do not need to switch onto a new filter the moment you feel that the carbon has run out, because in reality, HEPA is doing the heavy lifting for you. Another thing that you need to ask when buying a particular air purifier is, in 6 months, which is the standard lifespan of a HEPA filter, when I have to change it because it cannot be cleaned, will I have a replacement or not? So in that regard, established brands, established ecosystems will have available filters. This is important that because for every brand they want to maximize, the revenue from consumables as well. So the shape of the filter, the specifications of the filter will be such that open source or third party manufacturers will perhaps not be able to make them, and you will be forced to buy the filter from that particular brand only. To compound that problem, when you have these compatible with filters that are often available, their seal, the amount of seal or the air tightness that is there between the filter and the chassis of the air purifier is often not correctly assessed, and counterfeiters in this particular field are extremely common. Thirdly, it is always better to buy an established brand in India than to go with a startup or a very niche international brand, because then you do not know whether 2 to 3 years down the line that brand will exist here or not. And if you cannot change the HEPA filter, that air purifier is nothing but a piece of furniture. Now that you have bought an air purifier, or perhaps you are buying an air purifier, where will you place it? Simple logic is the inlet and outlet should not be obstructed. In offices or many times in homes also, for aesthetics, air purifiers are placed near the corners or sometimes hidden behind the curtains also. So that will significantly impact the efficacy, because the air inlet or outlet will be obstructed and purification will not happen properly. See, air purifier provides a flow, it does not provide a bubble. So if that flow is being obstructed by a piece of furniture or by a curtain, then you are not getting the benefits. However, if aesthetics are very important and you have to place it in a corner where nobody can readily see it, so it is better to go for a 360-degree inlet and place it 1 to 1.5 feet from the wall. Alternatively, today, many modern looking and sleek vertical air purifiers are also available, which perhaps can even complement the aesthetics. Also, if you have only one air purifier and you want to ascertain where to use it, always use it in the bedroom, since every human spends 1/3 of their life sleeping. Another thing is whether they have built-in AQI sensors or not. So the thing here is that because of a multitude of reasons, these are very inaccurate. Many of them are placed at the outlet, giving a false low reading so that the consumer feels that the air has purified significantly, while the reading is happening exactly at the outlet of the air purifier, not reflecting the true reading of the room. The main purpose of this is to document a serial decrement in PM 2.5 so as to see whether an air purifier is working or not. For vast majority, we do not need a separate PM 2.5 sensor. This just the fall in AQI or PM 2.5 in this sensor is adequate to tell you whether the filter is working proper or air purifier is working properly or not. But if you have someone in your family with severe asthma or lung disease, or perhaps a very young child, then perhaps you can use a separate monitor sometime. Other variables that are important here are you have to check where the inlet and outlet are. Some air purifiers have the outlet at the bottom, so placing them on the carpet will basically mean that that purifier is not working. There is no real way to check the seal quality, but if a air purifier has steady build, a snug fit, then probably the fit is good. It is always advisable to use the manufacturer's HEPA filter only so as to minimize these issues. As I mentioned, regarding HEPA replacement, modular filters are very common in brands because they want to encourage you to change the filter as fast as possible. And the earliest thing to change is to run out is the carbon. While pre-filter theoretically can last forever if you are cleaning. So they bundle the three of them into one. So what you have to do in that regard, you do not have to react on the carbon running out, which you will find out if there is a persistent odor in your room. It is time to change the filter when PM 2.5 is not adequately reducing or reducing despite prolonged usage within the room, despite a clean pre-filter. That is it. Because anyways, the carbon is not providing any meaningful importance to the vast majority of people. Lastly, some brands also market regarding that, it's a covered purifier, non-covered purifier. So if a purifier is not running and stored for a very long time, it's reasonable to have a cover. Running covers are almost always harmful because they are blocking the inlet and the outlet. If there are people who are living near, construction sites where there is very heavy dust, then there is something known as pre-filter sock or sleeve. What this does is this provides an additional pre-filter type of layer to the purifier so that you don't have to open the air purifier every time to have to clean the pre-filter layer. That is it. Otherwise, covers are typically not needed. And just a small word on the most recent trend, that is the portable air purifier or the necklace air purifier. They claim that there is a clear air bubble that is formed around the face, reducing PM 2.5. In reality, the flow rate of these purifiers cannot match the breathing rate of an average human. So there is no way air purification is happening with these devices. The claims have been made in very strict laboratory conditions, which are unrealistic as compared to the outside world, where there is also flow of the wind that may perhaps, replace the air before it reaches your nostrils. And just briefly about masks also, because air purifier is for indoor and mask is for outdoor. So, like I mentioned, H13 for masks, it is these standards. So N95, N stands for non-oil, meaning that it is not resistant to, it is not resistant to oil-based fumes. 95 means that 95% of 0.3 microns are removed. It is a standard. NIOSH is the Indian entity that approves these masks. Okay, then there in market you also have KF94, that is Korean filter 94, KN95, K is the acronym or the designation for Chinese standard, and FFP2, phase FF2, phase FP2, sorry, phase protector 2. So these are all acceptable. But the most common one that we have is N95, and N95 has this. So this is the language that you have to search when looking at an N90. When you are choosing a particular mask, the word N95 should be there. Mostly the good brands will mention one of these two things, non-woven or melt blown layer. It will always be there because this is the true filtering layer. All other layers are auxiliary. This is the layer that you have to look for. Then if you go on Amazon, you see 5-layer protection, 7-layer protection, 8-layer protection. In reality, as I mentioned, that non-woven layer is of importance. Other certain layers can add some comfort. Copper infused masks, no utility. Antibacterial masks, no utility. Masks with activated carbon, it requires a long time of contact between the air and the carbon for the gases to be absorbed, which is absolutely impossible when you are breathing. So that activated carbon is also not doing anything. However, when you have 8 layers, there is more resistance. You will have labored breathing early, and the life of the mask will reduce. So a standard N95 melt blown or non-woven N95 is good enough. Nothing above that, nothing below that. As important as the entity N95, the fit is important, because if the mask has leaks, then perhaps you are not achieving anything, because from that air pocket you will inhale unfiltered air completely. Fit testing, as we many of us would have done during COVID times, is a three-step process. You have to have an adjustable nose seal that you see. You have to have a leak test where you push the mask here and exhale, so as to see whether the air is coming out or not. And if you are a spectacled person and you see persistent fogging, then obviously there is a leak near the nasal bridge. An additional thing to tell here is that there are at least 5 to 6 shapes of N95 masks, depending upon the facial anatomy, and you can just choose the one which works best for you. This particular mask, duckbill mask, has a lot of space in front of the mouth, so for people who are claustrophobic, many of them find this to be much more comfortable. What other things you can see? Adjustable headbands. Yes, they are important for comfort, but not a must have. Many people would have seen these square dots on the mask. This means that all the layers that are there on the mask have been thermally bonded and not stitched via a needle. So the probability of leak through them is much lesser. Most modern masks have an adjustable nasal bridge, but if you are buying one which does not have, then that is a red flag. And lastly, the valve. So during COVID times, there was a lot of concern that walled masks should not be used. So the what the valve does is it makes the exhalation easier and reduces the heat or humidity accumulation within the inner surface of the mask. So it is comfortable. It does not have an impact on the efficiency or the effect of the mask. The problem is, in COVID times or during a pandemic, what the valve does is that if you are perhaps infected or in a latent phase, then that virus will be exhaled directly, which is why it was discouraged at that point of time. But for air pollution purposes, a valve is perfectly okay and perhaps even more comfortable. Additionally, storage is important. Whenever buying a mask, it's economical to buy them in packs of 10, 20, 40. Always ensure that each mask is separately packaged, because once the packaging is open and it is exposed to high temperatures or humidity, not only does the filtration layer get depleted or the electrostatic charge get depleted, very importantly, the rubber that is forming the straps gets degraded faster, leading to a very less likelihood that you will have an adequate fit. This is the most important reason why masks have an expiry date. Otherwise, theoretically, if the mask is stored in an airtight area, it should last forever. When talking about wear and tear, why this slide is here? Because typically we buy packs of 40. Always ensure that each mask has a separate packaging and store them in an area which is humid and not directly exposed to sunlight. This, anyone who has faced the pandemic would be knowing when to change the mask, when it is visibly soiled, or when the breathing becomes labored. It is time to change the mask. And on that note, just one thing, because a very common thing that is available nowadays is the reusable mask or the washable mask. So most of these are marketing gimmicks. You cannot actually wash an N95 because it is dependent upon electrostatic charge and those fibers which will get depleted if you wash. What some brands do is they have an outer cotton shell and the inner filter is replaceable. So they have 5 filters or 8 filters. So that is reasonable. Why? Because obviously you can wash the cotton shell without having an impact on efficiency, and per unit they turn out to be more economical. However, it has also been said by the makers of these masks that it is also has a lower ecological impact. That is not true. The filters are being replaced, so the polypropylene that is there in the mask that is causing the pollution and leading to non-degradable pollutants, that is being replaced at the same level. That is not there. And also there are hypoallergenic masks. It's not truly allergy, the redness you see when the mask is there, it is skin irritation from humidity. If you face that, buy them. Otherwise, no need to invest in them additionally. And just one last slide on other commonly asked things, what is the role of indoor plants? So they reduced volatile gases, but they do not have a meaningful reduction in PM 2.5. It is good to have plants indoors. They are aesthetic. The VOCs are reduced, but they are not a replacement for air purifier. Much more important is an outdoor green cover around the window. If you have the capacity to have an impact on that or have a discussion on that, because that traps the dust that is being produced by the roadways immediately in that area, reducing your PM 2.5 burden. Fogging, as is commonly done, does not have an impact. This is similar to rain reducing the AQI. It is only temporary, and the risks are dependent upon cumulative exposure. So if you do fogging, AQI will reduce transiently for 2 hours, but the thing you are trying to avoid from air pollution, which is heart disease, stroke, lung cancer, there will be no meaningful impact. And lastly, many Himalayan salt diffusers or lamps or reed diffusers or activated charcoal bags are also being marketed as ways of air purification. They have not been validated in any way, and it is very unlikely that they will have an impact similar to what a HEPA filter will have. So if you want to use them, you can use them, but not as a replacement for a good air purifier. Thank you.
I'm very skeptical about these air purifiers. I'm not very sure it can really filter. I'm not very sure whether it can filter 2.5. I don't think so. That's my feeling. Actually, I live just across the road in Lodi Estate, and they're given a dozen air purifiers. When they broke down, we called the manufacturers, and the engineer told me, what, sir, these are all fake. Government supplied at 13 of them. Sir, these are fake. The manufacturer's engineer tells me. I'm not very sure, Dr. Berry. Have you done really a test, you yourself, at Ames, about the efficacy of these filters? I'm not very sure. No. These are claims made by the manufacturers. To me, according to me, you cannot filter out 2.5. If we can't filter out 2.5, all these air purifiers are useless. Because that's what goes straight into your bloodstream. I'm sure maybe point 10, 10 it can be, PM10 can be filtered, but I don't think so. Even the gaseous parts, most of them can't be filtered out. That's my feeling, unless you have done some field test at Ames itself, which proves otherwise. Secondly, about your mask. It sounds good, but the point is, you're breathing out carbon dioxide and you're actually breathing it back in a filter, in a mask. You're breathing out, you're breathing in. I don't think there is any time frame by which these carbon dioxide can go out and then oxygen comes in, and unless you breathe oxygen, I don't think it's happening. I just think it's much more dangerous actually wearing a mask, because you're breathing out carbon dioxide and you're breathing it back again, which is much more unhealthy actually.
Slide देख सकते हैं क्या? Okay, I'll address the CO2 part first. So the membrane within the mask does not obviously stop the oxygen or the carbon dioxide that is there. Regarding the rebreathing thing, yes, that has been brought up multiple times in air purifiers also, because you are closing the entire room and the CO2 concentration of the room is theoretically supposed to rise. However, even in exhaled air, the CO2 content that is there does not typically go beyond 3 to 4%, because in a breath you are taking 500 ml and 150 remains in an area known as the dead space, which is the oral cavity and the nasopharynx behind it, or basically area where air is going but not being exchanged. So only 350 ml actually has a CO2 outlet. So the rebreathing there is typically not meaningful. And we have indirect evidence of that when we use, different types of oxygen masks or even isolated oxygen masks in the people. CO2 rebreathing typically does not happen to even, so there would be a clinically meaningful level where CO2 narcosis would, lead to perhaps headaches or dizziness. And then there would be preclinical levels where perhaps when you're doing a blood gas analysis and exactly checking how much PCO2 is there, even there it does not have an impact. So that is, and regarding the HEPA, yes, sir. Obviously, I am not aware of any specific study of Indian manufacturer in AIMS. Probably it has not happened, not during the 6 years I was there. So, just for the sake of clarity, this is the evidence that is there. So, these are based on H13.
Who is given this evidence? If you have not done it again, is it the manufacturer who is given this?
No, no, no. These I have not included any manufacturer-based study. I can share.
No, where did you get this information that it does, really filter off?
So there is a Canadian classroom HEPA air cleaner trial that was endorsed by the government because they were trying to figure out whether we install air purifiers in our schools or not. There was also a 2024 study that was done in China, again endorsed by the government, not by the, but I would have less faith on that particular study. And then there was also a crossover trial that was done. So crossover trial, basically what we do is half the population uses it and doesn't use it, and then you switch the population. That, let's say these 50 are using and these 50 are not using, then these 50 are using, these 50 are not using. So intra or inter-person variability is also accounted for in that particular setting. And what they found, because I agree with the fact that, a sensor saying that PM 2.5 reduction has happened is not adequate. Perhaps the sensor is rigged, perhaps the manufacturer has chosen which sensor to use. Perhaps the testing condition is so unrealistically stringent that it is an airtight sealed room because they want to make a very robust claim. So that is where perhaps these studies come into place. Because when we had an analysis of air purification and cardiac biomarkers, that is what I mentioned earlier, in a randomized setting. So, as perhaps you know, in a randomized setting, which means that if you have 100 patients or 100 subjects, you have to divide them in two groups. You do not know in which group that subsequent patient goes, air purifier or no air purifier. Because if I am conducting the study and I want the purifier to work, then people who are healthier and have lesser baseline BP, I will put them in the purifier group, and the or perhaps the ones which will have an unfavorable reading in the non-air purifier. So these studies are blinded, and I cannot tell or know which group the patient will go in. And because we are randomly assigning the confounders, we cannot see perhaps high risk of family history of heart disease, or family history of propensity for inflammation. They also typically get balanced out. So that is the rationale behind most clinical studies that we do, randomization and allocation concealment. When we had those studies, we could see clinically meaningful impact on the downstream effects of PM 2.5 inhalation, which obviously reasonably we can assess in a short time frame, which were CRP levels, IL-6 levels, ESR, which are inflammatory markers, one, and blood pressure, second. So, as I mentioned earlier, that is perhaps the most evidence we can have. Because if you ask me, see, you say ki, why you have to test this manufacturer at AIMS. I can go one step further. I can say, how do you know whether this PM 2.5 reduction in the room is leading to a lesser risk of lung cancer? And it is.
Unless you have really a long-term study.
So it's
you
not.
can't really do it clinically, examining X number of patients, unless you look at the history of
Yes,
that person.
and in that regard, we will need to have an individual PM 2.5 sensor continuously running for every enrolled subject to capture cumulative exposure for every subject. And pollution today will cause cancer 20 years down the line. We need to have this level of scrutiny for every patient in a sample size of 10,000, 15,000 over a span of 20 years. That is not possible, even for the most well-funded health institutions.
I think, doctor, my plain simple conclusion is if your AQI and obviously your PM2.5 from one is very high, beyond a certain level, you are bound to get cancer. Okay.
Right.
So I'm reconciling. I know it's going to happen. So it doesn't matter. May I?
Okay, so starting first with diet, this is important because there are a lot of claims, coffee, this cancer, and this. So basically, the thing in oncology or articles today is higher or higher slash lesser intake of X leads to higher slash lesser risk of Y, and random things come. Why that is the case? Because most of them are based on something known as the NANIS database. It was a US database where they said that we will enroll 50,000, 60,000 people, and we will document every aspect of their lifestyle and family history and diseases, and monitor them for 20, 30 years down the line. Statistically, to say that this is meaningful, we have something known as the p-value. Whether the association is by chance or whether this is a meaningful association. And typically it is taken as 0.05 for saying that this is significant. Simply meaning that there is only 1 in 20 chance that this was a random association. Okay. So now let us say you are sitting in a university and you want to publish a high impact paper, and you have this database available to you. Okay. If you run 20 analysis, simply by statistics, one will be positive, even if it is meaningless. Okay. And obviously the ones that were negative will have no traction. Ones that are positive will have traction, and they selectively get reported. So when talking about whether diet reduces lung cancer, conclusive evidence is for red meat and colon cancer. That is there because it has been independently validated. So independently validated means that the investigators made the claim beforehand that we feel red meat causes an increase in risk of lung cancer. And based on this hypothesis, they calculated a dedicated sample size, took a separate population, monitored them, and saw the difference. But for other dietary interventions, it is typically based on that database, and your guess is as good as mine. And as far as pesticide insecticides are concerned, they have, as of now, major studies have not been done. In vitro models are there, rat models, organoid models are there that they can cause cancer. But as I showed, in the IARC, that is why that classification exists, because what is the threshold at which you say this thing causes cancer, because it's a very major claim. So when we talk about group 1, they have not made it there yet, because it is very difficult to quantify exactly how much pesticide a particular person has consumed. And realistically, we may not have much of an impact on it. So for diet, red meat avoidance is one thing that is evidence-based to reduce risk of colon cancer. Obesity has an impact on risk of colon cancer, breast cancer, pancreatic cancer, renal cancer, because it drives systemic inflammation. Multiple studies have tried with Mediterranean diet, and caveman diet also. One study was there. Unfortunately, most of them are, like I told sir also, they are non-randomized studies. Okay, so you see, if you take 100 people on Mediterranean diet and 100 people on non-Mediterranean diet, it's not just the diet that is different. The person who is committing to that diet for a very long amount of time is different from the other people. He is very less likely to be a smoker, much more likely to have a healthier lifestyle, much more likely to be health seeking, going on screenings on a regular basis, getting evaluated regularly. So these confounders typically preclude meaningful inferences, which is why no particular type of diet has been, there have been multiple claims, but as of today, the recommendation on that cannot be made. Exercise does reduce risk of cancer, specifically colon and breast, and it improves recovery and prognosis in patients also. So most recently for colon cancer, there has been a randomized trial on exercise, that there is a lesser risk of recurrence in those patients if they are having 30 to 45 minutes of resistance training 3 times a week for a period of 3 to 4 months, which is, it has been published in the last 3 to 4 months only. Plus, exercise has many more additional benefits, especially. Yes, sir. Sir, study is ongoing on that. So in AIMS, we have a yoga center. So actually, a colleague of mine did have study on the impact of yoga and migraine and yoga and MUFs. That was a positive trial. It is waiting to be published. Pranayam specifically. So nobody is going to report cancer. Yes, that's good enough. And sir, when we talk about cancer, it's a 20-year follow-up. So it's not feasible to be able to do that study. Ground reality, most of the studies are thesis and dissertations done by PhDs or MD or DM. MD DM ka tenure is 3 years. If you give that guy this thesis, it's not going to.
Hey, may I? This side.
Big fan, then we had air condition, cooler. This air purifier used to be in factories and companies. This household air purifiers, since how long it is? And what is the minimum cost for this cost you have not mentioned, bearable cost? And apart from this, so many nitty-gritties you have given for this air purifiers. A common man cannot, he has to go, if at all he has to do this, he has to do a certificate or diploma course for understanding all this. What a common man, for the 7 steps before going to buy, what he needs to keep in his mind. Because he cannot keep all these datas.
So,
So
huh. So the cheapest air purifier I found on Amazon, fulfilling all these criteria, was 2,300 rupees. Okay, and if you are, you cannot remember perhaps 10 or 12 points, then it's okay to remember only 3 to 4 points. One, H13. Two, the inlet and outlet where you will place. Three, the cadder, or if you don't want that also, then whatever square footage you are planning to use it on, perhaps 1.5 times that, so that the sleep mode does not disrupt it meaningfully. And four, whether you have a replacement filter available or not. So basically a brand that has been in India for some amount of time, so that you can shout at a customer care executive when they don't give you the filter. That would be the minimalistic thing.
since how long this purifier concept is there in India? It is a Western concept. These are Western concepts.
Yes, sir, but pollution is more in India.
So household purifier since how long it is?
Since इंडिया में कब आए हैं? Sir, इस पे exact date तो I have not noted, but perhaps the last 10 to 12 years.
This side. Sorry. In AC, we already feel good, fairly good. So, should we use concurrently the air purifier also?
So for feeling good, AC is good enough. For PM 2.5, the purifier would be needed.
It is concurrently it is recommended.
AC air. Many brands make the claim they do not have a PM 2.5 reduction.
Because in winters it's a boon, but so it should be used concurrently also.
They are they are completely different. Air conditioning as a filtration process for PM 2.5, it is not validated, or perhaps by most brands not even marketed in such a way, because the fan requirement would be obscene. Instead, they make claims like antibacterial layer or copper layer. They are typically marketing gimmicks.
But these days we see advertisements about for the 2-in-1 things like AC cum air purifier. Are they okay?
So that is what I am saying. So that big HEPA filter, so as to cover the entire air outflow, would require a very noisy fan. It's best to just buy an air purifier. It's 2,000 rupees.
Separately, yeah.
Now
And like as in COVID, lots of people like used to take syrups, Ayurvedic syrups and steams and all that. Is that myth? Is that a myth, or is it helps? It helps in mitigating these things.
So, sir, regarding Ayurveda, as an oncologist, at least my personal stance is that it is very possible that it helps. In fact, we see a lot of patients who report benefit from taking those drugs. Our only concern is that if we knew exactly what is there in it, and it was tested in the same way allopathic medicines are done, then we would prescribe them left, right, and center. And
Not not the drugs, the homemade syrups and Ayurvedic.
so again, we need studies on that. That is the thing, because there. See, so in that, so for example, perhaps AIMS, mein there was a study regarding ginger for nausea, vomiting in chemotherapy patients. Positive trial. Acupuncture for breast cancer patients on a particular drug. Positive trial. Many of these things work. They just need to be incorporated in the mainstream research. Till that is done, it's difficult to make a recommendation as a doctor. Yes, sir. Steam is mainly, sir, for humidifying the secretions in the airway so that you can cough them out earlier. There is also some symptomatic comfort in people with cold. But regarding indoor air pollution, steam does not have any meaningful impact.
Or instead of N95, they are very easily available. Are they any good?
Those, so this question has been assessed independently in studies. Unfortunately, they do not provide protection. But the cloth mask. So there have been studies which have assessed N95, KN94, and cloth mask and surgical mask separately. They are not substitutes. They are at best for people who are, having cough with droplets. There might be some impact, so that the phlegm does not go. But when you're talking about tuberculosis, COVID, or PM 2.5 is even small, so they do not have a meaningful impact. It's better to not wear anything.
The blue one, surgical masks.
Yes, sir. That
Okay.
we've all.
And Doctor, thank you so much for a very informative talk. I have a very basic question. You have mentioned in preventive measures, keeping the windows closed, using air purifiers, using masks, etc. My question is how risky it is to walk outdoors, say in a park. Should we walk with masks on? Or is it preferable to use a treadmill? Should we walk at all? I mean, what is the kind of advice here?
So, ma'am, if we go strictly by the guidelines, then there is probably, by WHO standards, a good air day is unlikely to happen here. Realistically, as we can see here, you can base that decision dependent upon that day's AQI. So, you see this. So today, typically what I would say is that up till moderate, you can go outside. There is a caveat in this AQI also, because just because that is the AQI for your area, it does not mean it is actually for the area. It's just for that sensor. Many sensors are placed in the middle of a park, or as you might have heard that sometimes fogging happens selectively around these sensors to reduce the AQI value that is to be communicated to the people. So for that, there is no right answer. But if it is moderate or less, then definitely you can exercise outdoors. So that is impossible. It's better to reduce or improve the quality of emissions.
Because in Beijing, air pollution was very worse in
Yes.
some years back. But I think they have put a lot of these air purifier towers, and now
Yes, sir. But they also had differences. They also had changes at the industrial level and regarding vehicles also. Type of fuel, type of industries, shifting the industries to the outskirts. So probably these are the things. The Beijing is a case study for air pollution because 20 years previously from now, the AQI was what Delhi has today, but it improves drastically over the next 10 years. So for the last 5 to 6 years, Beijing has perhaps a very breathable air, given the fact that it is a very large metro city. But a big chunk of that is also because the industries have been shifted, the type of fuel, type of vehicle, and public transportation was heavily invested upon. HEPA filters for the ambient air outside, I don't think it is possible.
Dr. Praful, this is Suresh. Since last 50 years, if we can check, even though the pollution reversal also possible, examples of California and the Beijing recent times. So by taking these two cities case studies, is it possible in our capital and other areas as well?
Yes, sir. Not at Perhaps as an individual, no, but yes, it is absolutely possible because these were the same demographics. When you talk about Beijing, population density is the same, the sources of pollution are the same, type of pollutants are also very similar. So, with similar measures, it can happen, but that would require steps from the governing body that cannot be done by an individual.
The filter and other measures. What about the basic things? The dust is not removed from the roads at all. No mechanism is being developed in the last 50 years. And I have been attending all these things. They are giving us all the time data and all that. That nothing is happening on the ground level. You see the dust on the roads, the footpath, nobody is picking it up. Authorities are not there to tell them that remove this. And if they are removing it, they simply throw it in the middle of the footpath, just to keep their things away and all that. Nothing is happening on that place. If something happens on that, then we don't require all these things.
So, visible dust is PM10. That is would not be a concern for cancer. But what you're talking about, one very interesting thing is, what is done in almost all households, which is wet mopping, pocha. So that
Whole city, you see the dust everywhere. We see dust storm पूरा होता नहीं है, हवा चल रही है, dust उठा के ऊपर आ रहा है. Don't you think so?
so that is true, but then
वहाँ तो कुछ काम ही नहीं हो रहा. हम बात कर रहे हैं मास्क लगाओ, ये करो, वो करो. बेस रूट पे तो कोई कभी काम नहीं करता, नहीं कुछ आता था इसके बारे में.
मैं तो डॉक्टर हूँ सर, मैं इलाज कर सकता हूँ.
मुझे ऐसे लग रहा था जैसे आज कोई फिल्टर के लिए ना एक क्लास ले, तो भी करेगा. बोलना नहीं चाहिए मुझे, लेकिन बता रहा हूँ. तो बेसिक सारी कंसंट्रेशन फिल्टर के ऊपर होगी, लेकिन बेस रूट पे काम नहीं हो रहा. जैसे हम कारपेट बैठे ऐसे डस्ट कलेक्टर, बेसिकली डस्ट कलेक्टर, लेकिन वी कांट हेल्प इट.
Yes, so because the aim was what people can do as an individual to prevent, that was the focus. Otherwise, public and private I divided up front. But the thing is that as an individual who is attending this talk, detailing about the public measures and how they have worked in the past in other cities. Yes, sir. So not like there is a lot of data on that, but our teachers taught us at AIMS that this is perhaps one of the practices that has a significant impact on indoor air pollution, because a layer of water traps a lot of particles, including PM 2.5 and 10. So there's no harm in doing it. Vacuum cleaner. So vacuum cleaners, there are types again, but basically the problem is that if you have an extremely loud vacuum cleaner, or perhaps where the outlet has a very high blast of air, it is paradoxically worse. It leads to more suspension of the dust.
May I know the threshold value of the AQI when we should use the air purifier along with the AC, like this time of the year?
So if you can go to aqi.in, and the national recommendations are always mentioned here. See, for me personally, to make a claim on that would be very difficult, because by scientific methods, so you will always be in air purifier and mask only in India, given that the WHO threshold is now 5. But realistically, these things get recommended when you get into the moderate range or more.
Thank you. And what does the
Okay, so just to tell you, to allow, it's a way of communicating to the people the risks you are facing from the air pollution. So the air pollution you faced today was equivalent to smoking 2 cigarettes on this particular day. So this is for today in Delhi. But it's an indirect measure. It's not a justification for 2 more.
It comes up, before the pocha takes care of it. Does it have any 2.5, or is it just
Visible
an
dust is
irritant?
PM10.
PM10.
PM10 or more.
So that won't cause cancer.
So my name is Geeta Vora, and I'm a professional tarot card reader or holistic life coach. So the patient when comes to you, so do you have any collaboration with the holistic healers, or you prescribe the medicines as like the sir said that on the ground level or on the basic level, that how do you suggest them to heal, like with the
Okay.
fundamentals, like, or with the basic like meditation, yoga, and yoga, maya, shakti, pranayama, deep breathing. You suggest the medicines and everything. You tell
नहीं.
them. So do you have any collaboration, or you work like this, that you can refer them, that start doing meditations, or do you have any collaboration with the the self-ascended masters, or with the Advaita Vedanta teachers, so that you can uh, let them aware about all of these things, simultaneously with taking the medicines and all. So so that you can also work as a collective, as as a natural healer, kind of, because you
So
are a doctor. I can understand. So I mean, do you have like this kind of
so
mindset?
the team that I am working in, apart from just an oncologist, we have a psycho-oncologist, which is basically a psychiatrist trained specifically in cancer patients. We have a dietitian trained specifically in cancer patients, physiotherapist specifically trained, and a home care team. Apart from that, to every patient, we do tell that these are particular options that may make your journey easier, including yoga, meditation. And if they, since the evidence there is not very strong, so we cannot prescribe it as a must have. But if they show interest, what I personally do, I typically send them to the yoga center at AIMS, because one, I know that the practices there are uniform, and two, any patient that goes there is will inevitably be recruited as a part of a particular trial or a study. So when I send a patient there, I know that we are getting closer to an answer as compared to sending somewhere else where that patient may benefit or may not benefit, but it does not help the entire community at large.
Please, one more question. So, do you have like this kind of data or any study that you found out that because you were sending the patients to the meditation halls, and so any team like who is working on these statistics, that the patients who were sent to the meditation halls, they are they have improved faster than than the patients that who did not follow that trend.
So
So.
there is an ongoing study, but it is yet to be published. It's not my study. It is yet to be published. So we
AIMS is
cannot have we
is
cannot
AIMS
have
working on that?
yeah, AIMS as a dedicated yoga center. You say impact of yoga on insert disease here, and there is probably someone who is doing a dedicated research on that.
So, do you have any panel like besides you, that who are working on these things, that who are monitoring these kind of data, that
Like, they are
that you.
okay. So the data obviously is collected by the primary investigator, the one who has been assigned the study, and ideally they should not have a look at it till the study is completed, because then they can steer the study in the direction where they want it to go. For example, if you're a skeptic and you see the data midway, so you can tweak aspects of the study. Perhaps people who are less likely to recover, you put them in the yoga arm, and likewise. So when you mostly the studies that are happening are clinical trials, and the recommendation is simple: you wait for the adequate time and sample size, and then you open it for everyone to see. The statistician who is analyzing should not be aware of the claims that you are making. He will just analyze and tell. There is blinding at multiple levels. But yes, studies are happening in cancer also, for hypertension also. So in cancer, they are mainly happening for chemotherapy side effects, quality of life during the adjuvant, that is surgery ke baad wala phase, or in end stage 4 cancers in quality of life. Yoga meditation on risk of cancer, it's very unlikely to have that study, because the follow-up duration and the sample size would be obscene to have. My colleague had the study. So the yoga regime that was, in fact it was a running joke कि उसको बोलते थे हर presentation पे कि जो तू करवाता है वो करके दिखा. So it's a 45 to 60-minute regimented thing that is there, that has to be reproducible in a study, because you can't just say yoga benefited. So if yoga benefits and I have to say that, then the patient will ask me which yoga, which asana, for what time, under what supervision, how many times a week. So it has to be protocolized for the study. So despite it being a trial setting, meaning that there were at least 5 people behind, ensuring कि patients come on time, do the asana on time, do everything on time, compliance was defining perfect compliance was 15%. So to ensure good compliance in 10,000 people and follow them up for 20 years, that is not going to happen. But since we have many short to intermediate term benefits of yoga in protocolized ways, it makes a strong case for it anyway. So stage 1, 2 is curable. So cure, sir, when we define basically, it's not just there is disease free, जो से हम remission बोलते हैं, वो तो patient theoretically surgery होने पे ही हो गया. Then there is cure. Cure is when the risk of lung cancer recurrence is similar to perhaps my or your risk of lung cancer. It can never be zero. There will always be some risk for everyone. So that is typically for most malignancies is 5 years disease free. So this is achieved in 80 to 85% cases of stage 1, stage 2 lung cancer. The problem is at least 75 to 80% of cases in India of lung cancer present to us at stage 4. एम्स का ये वो है बिकॉज स्क्रीनिंग का एविडेंस फॉर लंग कैंसर इज नॉट वेरी स्ट्रॉन्ग. देयर हैव बीन ट्रायल्स, नेल्सन स्टडी, एनएसटी, बड़ी बड़ी स्टडीज हुई हैं स्मोकर्स में, बट द इम्पैक्ट वाज वेरी minimal. To pick up stage 1, stage 2, there is an odd patient, someone who is very wary of their symptoms, or very commonly we see कि एक्सरे किसी और वजह से हुआ था, उसमें स्पॉट दिख गया. So these are the patients who fare very well with surgery and only 4 cycles of chemo, and in very early phases even no chemo. But for the vast majority, it is not the case, because जब तक symptoms आते हैं, it has typically advanced to a certain level. And screening for India is very difficult for lung cancer. One, because X-ray पे tuberculosis can appear very similar. And अगर हर X-ray lesion को भी start biopsying, तो एक lung cancer पकड़ने के लिए शायद हम 19-20 TB की biopsy कर देंगे. One. And second, if you are screening the people, you need to have the infrastructure कि screen detected patient को appropriate time पे surgery and बाकी सब कुछ मिल जाए, which may not be the case in a lot of settings when you go outside the metro cities. So screening में it is simple. There has to be a preclinical stage you can detect. At that stage it should be curable. Typically when the disease presents to you in the clinic, it should be incurable. If it is curable throughout, no point of screening. If it is incurable throughout, no point of screening. So lung cancer में ये करने के लिए you have to ensure कि cure is happening, and that requires cardiothoracic surgeons and pulmonary function. It's a very heavy multidisciplinary team, which is why while the survival is very good, the number of cases that we see for that are actually very less, 10 to 15% as per the published data from AIMS, and many other series in India have reported a similar figure. It's very good, 85 to 90% is there. Lung cancer, there is only one marker, which is, there is a mutation EGFR T790M. That mutation has been, so there are 2 types of mutations, that mutation only in the cancer cell or a germline mutation, which is an inherited mutation that is there in all your bodies. This is the only germline mutation that has been found in research. It is also very rare. Most lung cancer risk tools are very polygenic and not validated. So like you said, BRCA for breast cancer, ovarian cancer, many BRCA adjacent genes are also there for these. There is something known as Lynch syndrome for colon cancer. So वहाँ पे there is a lot of evidence for genetic risk. Lung cancer में a particular mutation deciding risk is typically, and it's perhaps not going to be the case because it's mostly driven by smoking and pollution. Genetic predisposition has a role. There is just no objective test to pick it up. It's an interaction of many genes, hundreds or thousands of genes. And the more you analyze, the more noise also you get from the data. So you have to first reliably say that this particular gene or this genetic signature is leading to an increased risk. Then the next step is once you know that information, can acting differently have an impact? So like, for BRCA, the Angelina Jolie case that made it popular. So we have studies कि वहाँ पे mastectomy and oophorectomy increases survival because they are bound to have breast cancer, 85 to 90% lifetime risk if you are a BRCA1 mutant. Okay. No, 1 minute. So lung cancer में ऐसा है ही नहीं. And then the next step is to do a clinical trial of these particular. They are very rare to begin with. The scores are not validated. To have a population of 200, 300 and then randomize, it's better to just focus on smoking cessation.
So last but not the least, as you are a doctor, all right, so do you personally do meditation and yoga? Do you follow these in your daily routine?
I
Do you
meditate.
think that, if I do this and, on a daily basis, probably, I will be like, on a one day, probably I think that, my soul says from inside that, I can protect myself from cancer. Like, do you think that? Do you have a soul, says to you this thing from inside?
Soul to typically says घर वापस आओ, baby is waiting. But I do meditation sometimes.
Okay.
Because I feel that it has helped me with focus, especially before competitive exams or whatnot. But that.
So you think that it calms your mind and it lowers down the stress and anxiety levels, the meditation and all that,
Meditation and exercise, definitely.
and pranayama, like deep breathing, like some meditation, like
I
Do you
pers-
think?
It's not about what I don't do,
You
but
don't do.
perhaps it works.
Perhaps it. Okay. All right. Thank you.
So, ma'am, exercise is one. So, not every form of exercise suits everyone. If you're into resistance training, you can have sessions of up to 30 to 45 minutes, 2 to 3 times a week. That is enough. If you're into cardiovascular exercises, then moderate cardiovascular, pulse rate between 110 to 120, 130. So not that you're huffing and panting while sprinting, but a comfortable jog. That for 150 minutes a week. That is a significant reducer of lung cancer. Obesity, if one has it, then dietary modulation and whatnot. Now we have drugs for that also, but I won't endorse them very aggressively. If you can lose the weight naturally, that is the best. And pesticide, insecticides, pe we cannot have a control. Air pollution, pe partially we can have a control, but it's not possible for everyone to be very stringent on that everything. So exercise, diet, and stress handling would be the three things. So, and for stress also, there is no direct evidence, but stress causes inflammation. Stressed people are more likely to smoke. They are more likely to drink. They are more likely to stress eat unhealthy foods, which are risk factors. So why just for cancer? Why just specifically think of cancer? It's better to not be stressed. These three things I would say as lifestyle advices. I won't, typically for my patients, I don't advise them very aggressively for lifestyle, because if somebody gives me that advice, a checklist of 30 things, I will probably not do even one. Compliance is the most important. So
You are talking absolutely right, I believe. It's not for only cancer. Like, someone has cancer, you like holistic well-being, all right? You prefer medicines and, besides, simultaneously you tell them, as you say that, that just do meditation, pranayama, just for your holistic well-being, so that your overall health will be good. Or, because it's like lots of pollution, like as Sir said, waste is there on the roads, dust is there. So as because collectively, like when we step out of our homes, we don't feel very comfortable because everywhere is like mess. So we more need, like we need, because it's our own responsibility. You are doing your responsibility as a doctor, but as a doctor, I think you tell your patients that I think you must tell as you do. It's because their accountability, like to follow these things, in their daily routine. Because I think it's must, like to do pranayama or to meditation just for the holistic well-being, just for overall health. And obviously, if overall health improves, so obviously I think it will affect on the cancer as well, because cancer is a part of the collective. So I think.
Yeah, so that's what when we have a patient with, in today's day, health anxiety is a very common term. मुझे ये तो नहीं हो जाएगा, वो तो नहीं हो जाएगा. So when we see that, we tell them very clearly, you are not trading diagnosis कि मुझे cancer तो नहीं होगा यार, heart diseases हैं, strokes हैं, सब कुछ है. If something is beneficial overall, just do it. Why do you need data on cancer specifically to do that? So exercise, diet, and managing stress effectively, perhaps by therapy or yoga or whatever suits them the best.
It's like ancient civilizations. If you just see the golden age, like if you talk about the Satyuga, it's an iron age. We are in Kali Yuga, right? So then the golden age, and then the silver age, and then the bronze age, and now it's a iron age. So it's a fourth yuga, like fourth aeon, fourth epoch we are living. So if we just see our ancient civilizations or ancient seers like shamanic healers, on a larger way that they elevate the consciousness. So if we just see that data, on a basis of that, we see this, that all these things were recommended at that point of time, because in ancient times the people used to do, they at that time it was not so much of air pollution or cancer patients we observed. Only in this Kali Yuga we are observing, because people are not you know more materialistic, not very very keen to meditation, yogas and pranayama these days. And that's why I think you as a doctor, because the patient comes to you when they get sick, all right, so you heal them, right, you give the medicine. So I think it's the best way that because the patients are coming to you, so you can tell them these things, that please inculcate or initiate these things in your life, because it will improve you and as well as the collective, like as a holistic well-being. So I think sir, I think that you should start something in the aims, that as a holistic well-being program kind of, so that the patients will see the the chart or something, that with all the panel lit doctors, so that they can also go to the some holistic healer as well, simultaneously, like with taking the medicine, so that they will have that regime as well, that how to take care of the overall well-being as well. This is my point of view. That's it.
हाँ मैम, आप टीम ज्वाइन कर लो.
Our constitution gives us right to life. And by seeing the following from my first interesting all of us so-called intellectual of the society. हम सब लोग just run around as if कुछ हो नहीं रहा है. AQI has surpassed beyond the limits. तो मुझे ऐसा लग रहा है कि as a citizen क्यों कोई movement नहीं हुआ है, क्यों like वो PI नहीं फाइट कर रही है, ये तो हमारा rights का हमने fresh air, it is like basic necessity, no? क्यों हमें air purifiers घर में रखने पड़ते हैं बच्चों के लिए? कैसे वो अभ्यास कि हम पे जो भी जैसा भी होता जा रहा है, like we are silent spectators.
तो मैम इसमें तो without giving a very direct answer, I would say that the changes on which basis votes are there, those changes will happen. The day AQI is a significant enough thing that the common man votes a particular way based on that, then I personally feel, obviously this is not the medical field, but I personally feel that when there is an election or a governing body is being chosen, regardless of who comes to power, the main mudda or the main issue because of which the population voted, there will definitely be at least some change for that. So if
पहले सिगरेट्स पर आज भी निकले आई रिमेंबर उस टाइम पे ये कहा जा रहा था कि 40 cigarettes you are smoking daily. I was just wondering, मतलब 4 nights back I was in Europe. तो मैं देखी थी उनका एक बार मुझे ऐसा है कि आपको लैंड होते ही महसूस होता है कि मतलब कुछ बेटर है. और यहाँ वापस लैंड होते ही ऐसा लगता है कि अभी तक भी अगर विंटर्स आएंगे फिर वही मतलब साल मुझे ऐसा लगता है कि हमारी गवर्नमेंट्स हमारा क्या करें एक तरह की वॉकिंग हो रही है कि हर साल वही जुमले हम सुनते रहते हैं कि ये हो रहा है वो हो रहा है ये होगा वो होगा. कहाँ पे इफेक्ट आ रहा है. अब जब टावर्स की बात करें तो चंडीगढ़ एडमिनिस्ट्रेशन का ऐसा सर्वे किया, वहाँ पे चंडीगढ़ एडमिनिस्ट्रेशन ने टावर्स इंस्टॉल किए थे. तो अल्टीमेटली जो रिसर्च आउटपुट आया दे वर इनइफेक्टिव एंड द फर्म वाज आस्क्ड टू डिसमेंटल इट. The coming winters में क्या हाल होगा, वेस्ट एंड ड्रेन. So these are all the support systems. We can only create, can only support us. But the base जैसे सब बोला कि roots cause क्या है, the root cause और root से हमें नहीं अगर बोला है तो उसके लिए से हमें overall picture पे काम करना पड़ेगा. Like as a collector, we have to take accountability, like each one of us. And I think that is like starting from the low Maya Shakti. क्योंकि हम ये सारे जो है माया नदी में रहते हैं, और इससे हमें रूट से what is root, क्योंकि सबसे पहले जो संत लगाते थे शक्ति को योग माया शक्ति का ध्यान करते थे. ठीक है, because I am an ancient seer. I have a teacher channel by the name of Shiv Shakti Kalidana W1 So there are the 67 videos and those are channel messages. मतलब मुझे डाउनलोड करते हैं हमारे रैम से, and then I make the videos and share with the collector. Because I have to give something new for the collector. That is the guidance from the Supreme Court. तो योग माया शक्ति का ध्यान लगाते हैं सबसे पहले इनिशिएट करते हैं कि हम जो है इस योग माया से दूर हो रहे हैं, अपने योग माया शक्ति का ध्यान लगा रहे हैं. उसके बाद में फिर 12 बार only 12 times. Why 12 times? Because it's a spirituality and plus meditation. मतलब हम practicality और उसको हम balance program में डालते हैं. 12 बार में हम just watch the breath. That is called anapana. Inhale and exhale meditation. Just watch the breath just 12 times and just for 20 days. It will definitely improve. This is a very basic. Because all of the things which we are inculcating in our society, these are the support systems, right? All the things based on everything काम करेगा, कोई कैसे काम करेगा, कैसे काम करेगा, right? But that is a very basic. We should actually build some meditation goals, so that the energy will level up, on the mother Gaia, on the mother earth, so that the level of the energy will rise automatically with these kind of meditations. So I think we should build the more meditation halls along with the hospitals, and I think we should do something on this because hospitals can do it because the patient comes from you, right? So you can collaborate with the self-funded masters or with the ISKCON temples or with the great Vedanta teachers or with the holistic healers, who are working on the energy level, so that we can build the meditation halls and we can refer the patients to the meditation halls along with the meditation, so that they can work on themselves and obviously work on as a work on overall well-being. अगर कोई आइडिया अच्छा लगा तो प्लीज शेयर दिस.
thank you.